Good afternoon, everyone. It's so wonderful to see so many familiar faces and some new faces, and to finally be in our launch together of the inaugural Alliance Equity Learning Collaborative. So we're so excited to have you all here today. We're so excited to meet all of you who maybe we haven't had a chance to meet yet, and to really learn and grow together in this exciting equity journey. So my name is Marley Williams. I use the she, her pronouns, and I am the Health Equity and Justice Manager with the Public Health Alliance of Southern California. And as folks are joining us, if you could actually take a moment to make sure that your name is in the Zoom. So if you can name yourselves along with your preferred pronouns. And then if you could just maybe add where you're coming from today. So what jurisdiction you're joining us from. So you don't need to do the whole department because we're all from public health departments or agencies. But if you could maybe put Orange or Imperial or Long Beach, just to let folks know where you're coming from today. And for those of you that may not be familiar with the practice of identifying your pronouns, we've put a link in the chat to support you in utilizing that practice and learning a little bit more about it. So please do use the link in the chat if you can. And if you have any trouble renaming yourself, please go ahead and shoot a message to myself or Savannah or Anna, and we're happy to help you all with the renaming in the chat. If you want to look at my name and the way it's written out, I'll give you an example of what we're hoping folks can do. So next slide, please, Anna. So before we launch into our really packed and amazing agenda today, I just want to take a moment to acknowledge the unceded Kumeyaay territory that I currently sit on here in San Diego County. Many of you are probably familiar with the practice of land acknowledgement, as it is rapidly emerging as a standard throughout much of our region. You may have seen land acknowledgements in your own boards or city councils, and it's really a recognition not only of the importance of understanding the historical context of the places where we live or work, but also the importance of understanding the ongoing impact of factors like colonialism on Indigenous health and other outcomes. We would also encourage you to take a moment, if you're not familiar with the practice of land acknowledgement, or maybe you've seen land acknowledgement, we are going to continue to highlight equity practices throughout our collaborative time together. So we're sharing a link in the chat that will give you a little bit more information and background into the purpose of a land acknowledgement, why you might want to use it or incorporate it into your own equity practices. We also encourage you that in doing a land acknowledgement, you also identify what are the local Indigenous movements happening in your own communities, and how can you as individuals or departments be allies to those movements. So I would encourage you to familiarize yourself with your own jurisdictions, maybe local land back movements or other Indigenous rights movements, and really take this practice back as a change team and maybe discuss how it can be incorporated into your own work. I also will put in the chat, one of my team members is putting in the chat a link to Native Land, which is actually an amazing resource to share in community as well. You can enter your address of either where you live or work, and you can identify the Indigenous people's land on which you work or live. So both of those resources are in the chat as well. And I will hand it over to Anna for some brief logistics for today.
Great, thanks Marley, and good afternoon everyone. I am so excited to be here with you all. As Marley said, my name is Anna Bonilla and I use she, her pronouns, and I'm the Health Equity and Justice Coordinator for the Public Health Alliance of Southern California. And I'm really honored to share this space with you all and co-facilitate this collaborative with my colleague Marley. And I'm looking forward to sharing more about myself in just a little bit, but also getting to know you all over the course of our time together in the collaborative. So on to our tech logistics. So by now, I know we've all seen some version of this list of tech logistics, but we never want to assume, and we want to make sure that we're setting up common expectations on how we can build this virtual space together. So first, we ask that you minimize your distractions. We ask that everyone be present and engaged as much as possible during our time together. As a default, please keep yourselves muted when you're not speaking. And when you are, if possible, please try to reduce your background noise. We also encourage you all to engage and participate. This space is your space, and it is what we make of it together. We've thought of several ways to make it a dynamic and engaging space during our time together. So you can utilize things like the chat feature, raise your hand when you want to speak, or use several of the Zoom emojis if something's really speaking to you in some way. And as you can already see, we're going to be actively using the chat. So we've already popped in a couple of links, like why we use pronouns, where you can find resources on native land acknowledgements. But we'll also be putting in more resources during our time together as we're mentioning them during the presentation. And lastly, take care of yourself. If you need a step away, please drop us a note in the chat to let us know. But we want to make sure that you're taking care of yourself while we're together today. And on a final note of technology, we really want to ask and encourage people to be on camera during the duration of our session. We completely understand that the dynamics of virtual meetings are not the same as in person. We've all been doing this for about a year and a half, and the Zoom fatigue is real. However, being able to see everyone is really helpful to engage in the conversation, for our guest speakers to see our reactions to their presentations, and to really bring a different energy into this virtual room and space that we're creating together. So we ask that you turn your cameras on, and if you're unable to do so for any reason, we also respect that as well.
Thanks, Anna. And now we're going to turn it over to Tracy. I'd like to introduce Tracy Delaney, our founding executive director of the Public Health Alliance of Southern California. She'll welcome us all and share a few remarks.
Great. Thank you so much, Marley, and good afternoon. It's wonderful to see all of you today. As Marley said, my name is Tracy Delaney. I use the she, her pronouns, and I am the founding director of the Public Health Alliance of Southern California. I'd like to welcome the change teams of all of our member health departments. And I'd also like to extend a warm welcome to an additional local health department that's joining us for the Learning Collaborative. Those are our colleagues from San Luis Obispo, so welcome. We're really happy to have you join us. For those of you that are new to the Public Health Alliance, I'd like to provide a brief overview. The Public Health Alliance is a coalition of the executive leadership of 10 health departments that together represent 60% of the state's population. Our vision is vibrant and activated communities, achieving health, justice, and opportunities for all. And our mission is to mobilize the transformative power of local public health for enduring health equity, exactly what we're doing here today. So the Alliance works to achieve our mission across 5 strategic areas, and you can see those include advancing health equity, championing prevention funding, promoting powerful, healthy communities, elevating the climate and health nexus, and transforming data into action, which includes our California Healthy Places Index. So we're incredibly grateful and excited to have this opportunity to be in space with all of you this afternoon. When I first launched the Public Health Alliance almost 9 years ago now, I think none of us could have imagined this historic moment that we find ourselves in. We're living through the greatest pandemic of our lifetimes. And while we have faced unprecedented work, loss, and tragedy, in so many ways, Arundhati Roy so eloquently said that the pandemic also serves as a portal for all of us to envision a more just and equitable future. A future where all of our community members, regardless of where they're born, their race, their income, or any other personal factors, have equal opportunities to live long and joyful lives. It's also a future where our public health departments can re-envision and pave the way for other governmental entities to embrace their own role in advancing health and race equity, and to transform our systems and structures so that we can have a more equitable and just future for future generations. I'm so excited and proud to see the ongoing ways that all of you are committing to this work. And my team and I have been looking forward to this launch today, and we're very excited to partner with all of you on this learning journey as we work together to create more resilient, just, and equitable region. We hope you'll take away something new from today's session and also begin to strengthen and build connections and opportunities with each other, your equity leader colleagues. Thanks so much for your time, your passion, and your commitment to this work. I'll hand it back to Marley and Anna.
Thanks so much, Tracy. So we have a robust Public Health Alliance team that is involved in this collaborative, and you'll see different members of our team joining throughout our time together. But for today, you're going to be spending a lot of time with Anna and myself. So we wanted to take a moment to introduce ourselves a little bit more fully and also provide you all some context for those of you who don't know us. We want to give you a little background about what we bring to this space and what drives us in this work. Some of you may be familiar with this practice. In some places, this is a version of a practice called Story of Self. Once again, this is an equity tool that you can use. It can be a great tool for entering a conversation, especially when you're entering a conversation with community, to help really level set and ground set where you all are coming from and what motivates you in this work to advance equity. If you like this practice, we're going to share slides out after. Anything that you see in the collaborative, we will share with all of you. So slides, this is being recorded. So all of our group session recordings will be shared. And if you like this practice, we encourage you to also incorporate this type of level setting into your own work in your departments and with your community. So just to take a quick step back, as I've already said, I am the Health Equity and Justice Manager here with the Alliance. I've been with the Alliance a little over 2 years. I am the proud mixed race daughter of a Lumbee Indian father. I'm an enrolled Lumbee Indian tribal member on my father's side, and I am Ashkenazi Jewish on my mother's side. I am the daughter of 2 civil rights and social justice activists. So I often say I was marching in immigrant rights marches before I could walk, often on my father's shoulders. And because of my father's profession, he works at the University of Arizona. I was raised in an upper middle class neighborhood in Tucson, Arizona, and was the beneficiary of a top tier, well-resourced K-12 public education system. And this education really afforded me the opportunity and access to a high quality post-secondary education. Because of my background, I was raised in a community of Indigenous and Chicanas activists. I have really spent the entirety of my career working to advance equity and justice across systems and sectors, including in government, philanthropy, K-12 and higher education, and nonprofit sectors. And I really see my purpose in this role, but also really in my career as supporting institutions in dismantling the systems and structures that perpetuate inequities, and to support all of you in working with community to really co-create sustainable solutions that will achieve health equity and justice for all. Anna?
Thanks, Marley. I actually first heard about the Story of Self and what the Alliance has done and how it's been inspired by it when I started with the Alliance, and I really appreciate how it's such a different way to enter a space, a different way to introduce yourself to community a little more fully and be able to share that with each other. So I'm really excited to share a little bit more about myself as we'll be spending a lot more time together. So I identify as a Latinx woman. I am the daughter of 2 immigrants from Nicaragua who came here in the 80s, fleeing civil war. And I was raised in a mixed status family for several years where Spanish was my first language. I was born in East LA, and I spent most of my life, over 20 years, in public housing in Long Beach, California. And I benefited from several what are called social safety net programs like free or reduced lunch, food stamps, or free or low-cost healthcare. And really a lot of my personal experiences growing up have really influenced and drove what I'm passionate about today. And that brings me to where I am today, which is the Health Equity and Justice Coordinator with the Public Health Alliance of Southern California. I'm proud to be part of the equity team that is working to support our members in advancing equitable policies and practices, as well as advancing our own organizational equity goals. And for over a decade, I've really worked to improve community health outcomes through policy, systems, and environment change, really got my start with building healthy communities here in California. And since then, I have focused on built environment and health, land use, gentrification and displacement, and the health effects of gentrification and displacement, affordable housing, and now in my role with equity here in the Southern California region. And I truly believe that every facet of our lives has an impact on our health. And I really hope that in our work, we can bring together other sectors to also lead as champions in advancing health equity in our communities that have been historically and disproportionately impacted by inequities.
Thanks, Anna. So quickly, we know we sent you all the objectives for the collaborative, but we actually got this request from all of you to have this space where we could bring together equity champions and public health leaders from throughout our region to really dive deep into a lot of the emerging and priority equity, health equity, and racial equity and justice topics that you all are tackling in your jurisdictions. And so what we heard from all of you is that you wanted this space to really strengthen your local public health jurisdiction infrastructure and capacity to advance health and race equity. But we also heard that you wanted to build and strengthen relationships across your own staff, but also across local health departments throughout our region, and to really facilitate cross-departmental and regional communication collaboration. So in every session, we will make sure that you have an opportunity to meet folks from other departments throughout the region, but also that you have an opportunity to dive deeper in your own equity change team for your department. We also want to support you all in building collective capacity and alignment for advancing health and race equity. We know that the borders that we have in our counties are not real, right? We have folks in our communities that live one place, work another, play or pray in another place. And so we need to really develop a regional vision for advancing health and race equity if we truly hope to get to where we want to be as a strong, equitable Southern California. And then, as we've mentioned, we will continue to infuse and elevate promising and best equity practices. And we will do that through a variety of mechanisms. Today, we have an amazing speaker panel of equity, really national public health equity leaders coming to join us to discuss how they have grown their own organizational capacities to advance equity. We will elevate practices through these collaboratives, and we will also be using our Regional Equity Learning Collaborative webpage as an active resource to share tools, strategies, and approaches with all of you on an ongoing basis. Next slide, please, Anna. So just to give you a brief overview of today, you probably already saw the agenda. We will have a few group breakouts, so please stay on camera in those group breakouts because you'll have a chance to meet one another and engage. And we encourage you to be really active in those group breakouts as well. We will also have an amazing speaker panel. We'll be joined by Ana Lilia Garcia from Santa Clara County, T. Benicio Gonzalez from Louisville, and Megan McClare from Los Angeles County, all to discuss launching and growing their own offices of equity and building their equity capacity. And then we will also close with some next steps and some of the ongoing support we'll be offering between now and our next session. Next slide, please. Great. So we do not have time. As you see, there will be lots of opportunities to engage with one another, but we don't have time for everyone to do individual introductions. We're not going to do that with 50 plus people, but this is a really exciting space. I'm so excited that we have so many local health jurisdictions in this space. Some of you are together, so come off mute together when I cue, but I just want to quickly give recognition to the amazing change teams that have all come together to commit themselves to this work. So when I announce your jurisdiction, if you can come off mute, cheer, shout, say hello, express why you're excited to be in this space today with your colleagues and friends. And I will start with the Public Health Alliance team. So Public Health Alliance team, say hi, show why you're excited to be here. And if at any point you want to message anyone in the Public Health Alliance team, we are all here to support you. So thank you, team. Imperial County. Do we have some Imperial County folks out there?
Hi, Andrea here.
Yay, thank you, welcome. How about Long Beach?
Oh.
How about Los Angeles?
Woo!
Welcome, LA. Orange County?
Hello.
Hi.
Welcome, welcome, Pasadena.
Right here, we're in the
Hello,
house.
everyone.
Hi.
Yeah, Pasadena, welcome. Riverside,
Woo!
Hello.
welcome, Riverside. Santa Barbara,
Woohoo! We're
Santa
here.
Barbara.
welcome, welcome. San Luis Obispo.
Thanks for having
that.
us. We're
Lots of
so
energy
happy.
from San Luis Obispo. Welcome, welcome. And last but certainly not least, the folks in Ventura. Welcome. And I love that your change team is all together in one space. That's awesome. So welcome, everyone. We're so excited to have you all.
San Bernardino's
here too.
Oh, no.
San
Sorry,
Bernardino.
San Bernardino,
We
welcome.
are here. Don't forget us.
We're here. We're all here.
Yeah, sorry,
Come
you are
on.
on the slide and I skipped past you, but that I apologize. It's my eyes. Welcome, 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 everyone. So great to see you all. Very excited to be here with all of you today. Great. So we are going to break into our first group soon, but before we do so, we just want to take a moment to first lay some groundwork for our collaborative. So before we dive a little bit deeper into all the ways that we can build our organizational capacity to advance equity, we want to recognize and acknowledge that it's important to take a step back and think critically about what we even mean by the term equity. What do we mean by the term racial equity, health equity, justice, applying an equity lens, racism? So we're going to continue to build a shared regional language throughout our time together. But we know that one of the core building blocks for advancing equity is developing that shared language. Because without it, we can't assume that we're all referring to the same issues when we use the same terms, right? So really developing this shared language is a platform on which health and racial equity work stands. And too often work around health and racial equity can get detoured because we're using the same terms, but we mean different things. So we'll infuse some shared language throughout our time together. I also want to give a big shout out to the folks in the equity work group who are also in this space who have actually contributed to a shared equity work group glossary. That glossary can be utilized actively by all of you. We encourage you to take that glossary as a living resource. Go back to your own communities, make sure that those words and definitions feel true to your own communities, but know that resource is out there. It was developed collaboratively by representatives from across our region, and we have shared that on the webpage and can also pop the link into the chat. So next slide, please. So I'm not going to belabor this image because I know all of you are very familiar with the apple and the apple tree equity and equality image. In fact, I think I recently had one of you share that you physically were holding apples in order to demonstrate the equality versus equity apple tree image. But I do just want to start with this image because I think it is a strong visual depiction for explaining equity versus equality. It's certainly not a perfect depiction, and some folks have raised some ableism that's apparent in this depiction, and so there's a lot to discuss and unpack within every sort of visual representation of equity. But if we just take this image for a second, we can see that in the image on the left, which is depicting equality, folks are all given equal opportunity to reach that apple. But what we know is that not everyone is starting from the same place, and not everyone needs the same kind of support to reach the apple in the apple tree. So when we don't recognize that folks need different supports to reach that apple, what happens is not everybody can enjoy a delicious apple in the apple tree. In the picture in the middle, which depicts equity, we can see that folks are given the supports they need to reach that apple. And when those supports are given, everybody is able to enjoy that delicious fruit. What I like about this visual and why I still sometimes use this visual is two things. So one, I would take a moment to actually recognize that the boxes themselves play a very critical role in this visual. And the boxes can actually be a great way to spur conversation with your own community members. Because if you imagine for a moment that those boxes are the critical equity supports that our community members need to thrive, you can actually engage in a conversation about what might you be filling those boxes with, right? So are you filling them with health and racial equity training, with regional learning collaboratives, with policy and systems change, with a different way of hiring or retaining staff? So really you can imagine what needs to go into those boxes so that all community members in my community can thrive. And something else I love about this visual is that it clearly shows that there are enough apples in the apple tree for everyone. So oftentimes when we talk about equity, folks can frame it like it's a pie and that there are not enough pieces for everyone. But in fact, what this image shows us is that with equity, we can all enjoy the apple in the apple tree. Finally, some of you may not have seen this third image. And what this third image depicts is the concept of justice. And we're all discussing justice right now in our own work. But what I love about this is that justice can actually take equity one step further by fixing the system in a way that leads to long-term, sustainable, equitable access for generations to come. What's beautiful about this picture is that with justice, no supports are needed because the cause of the inequity itself is addressed. The system is changed. We know that this image is what we are ultimately striving towards in our work to advance equity. But we also know that before we can reach this ultimate goal of justice, we must first work to achieve equity and acknowledge and address those systemic barriers that we need to really break down and rebuild. And so we'll continue to engage in this idea of how do we even take equity one step further in order to achieve justice. Next slide, please.
Great. Thanks, Marley. And, in our collaborative and in this session, there's a lot of talk about equity, but we'll also talk about equity from a health frame, otherwise known as health equity. Now, the Public Health Alliance uses the Robert Wood Johnson definition of health equity, which means that everyone has a fair and just opportunity to be as healthy as possible. To achieve this, we must remove obstacles to health, such as poverty, discrimination, and deep power imbalances, and their consequences, including lack of access to jobs with fair pay, quality education and housing, safe environments, and healthcare. We feel this is a really powerful definition as it requires us to take action to achieve equity, which includes removing some of these pretty powerful structural obstacles to achieving health equity in the first place, like poverty, discrimination, and powerlessness. This definition requires us to think about health equity as a long-term transformative process.
So we also want to acknowledge that in the work we do, we here at the Alliance, at the Public Health Alliance, we lead with race explicitly, though not exclusively. So throughout our time together, we're going to discuss the ways that structural racism lays at the root of the inequitable health outcomes we see across the board and the inequitable outcomes we see in education, housing, and other social factors. We know that structural racism lies at the root of why, for example, Latino women contract cervical cancer at twice the rate of white women. Black women are less likely to be diagnosed with breast cancer, but have higher incidences of mortality than white women. And why American Indian and Alaska Native adults are 60% more likely to have a stroke than their white adult counterparts. We also want to acknowledge intersectionality, and we use the definition of intersectionality coined by the scholar Kimberly Crenshaw. And that definition tells us that when it comes to thinking about how inequities persist, other parts of our identities like gender, race, and class are not mutually isolated, but are in fact overlapping. And so oftentimes these multiple identity dimensions mean that we experience bias, racism, and inequities in a myriad of ways. And we want to acknowledge that in our work in departments and also in our communities. If we truly hope to eliminate inequities, we have to be willing to name structural racism as the root cause and commit ourselves and our institutions to upending it.
And because racism is so widely talked about today, we believe that it's important to actually define what we mean by racism. We really like Dr. Kamara Jones's framework, where she emphasizes that racism is a system of power and not an individual set of actions. that it is a system of structuring opportunity and assigning value based on the social interpretation of how one looks or their so-called race. And because the system of racism disadvantages some, but also unfairly advantages others, it really saps the strength of our whole society through the waste of human resources. We'll dive deeper into the ways that racism impacts health outcomes in our next session together in January. But for now, we wanted to provide you with some foundational language to start to develop our shared definitions and understanding across our region.
Thanks, Anna. So we're going to break out into our first regional group shortly, which I'm sure you're all excited to meet one another and dive a little bit into your own visions for an equitable Southern California. But let's just take a moment to ground ourselves in what has even brought us to this space today. This past year and a half, almost 2 years, has been an unprecedented time in our history. We know that the COVID-19 pandemic did not cause these vast inequities that we have seen in our community, but it has laid them bare, and it has exacerbated the underlying inequities that have festered in our country for centuries. We have lost over 700,000 American lives to COVID. I know I don't need to tell any of you that you all have been working tirelessly throughout this crisis, and you've seen the impact in your own families, communities, and your workplaces. But we also know that the brunt of this pandemic has not been borne equally. And when adjusted for age, we know that Indigenous Americans are almost 2.6 times as likely as white Americans to have died of COVID-19, that Latinx and Pacific Islander Americans are 2.4 and 2.6 times as likely to have died of COVID, and that Black Americans are 2 times as likely to have died of COVID as white Americans. And we know that that is tens of thousands of lives lost throughout our country and in our own communities.
And that was just the national snapshot, but we know that much of the same is happening here in California. We're experiencing the same inequities by race, and it's apparent in the COVID-19 cases and deaths. In particular, our Latinx, Black, and Pacific Islander community members have seen some of the most devastating and stark inequities in COVID-19 cases and deaths. And we also know that the pandemic has taken an incredible toll on American Indian and Alaska Native communities who are often misclassified racially in the data as other or Latino. And we also know that our inequities in COVID-19 impacts and outcomes also differ significantly across place. Neighborhoods with the least healthy community conditions, shown here as quartile 1, had mortality rates that were 3 times higher than those with the healthiest community conditions, shown here as quartile 4. Due to historic and present day racism and discrimination, from things like redlining to deed restrictions to blockbusting, many communities of color, especially Black, Latinx, and Indigenous community members, have been pushed into some of our least resourced and most disinvested communities throughout Southern California. And as a result, for people of color living in our least resourced communities, outcomes were even more stark, with people of color living in communities with the least healthy conditions often experiencing the most cases and deaths. This once again demonstrates the critical importance of both race or racism and our zip code on our health outcomes.
So if we just look at 2 particularly stark examples, we can look at 2 examples of community conditions that have played a large role in driving these inequities in health outcomes throughout the COVID-19 pandemic, and that is employment and housing. So we know that one of the most influential factors in terms of COVID exposure and death has been in relation to employment and who can safely and securely work from home. We know that Black, Latinx, and NHPI folks are disproportionately represented in our frontline or essential work throughout this pandemic, and all of you have been doing amazing work to reach your frontline and essential workers. We also know that less than 1 in 5 Black workers and roughly 1 in 6 Latinx workers are able to safely work from home. This inequity is also driven by income. So we know that higher wage workers are 6 times as likely to be able to work from home as lower wage workers. So this means that throughout this pandemic, low wage, Black, Latinx, and other workers of color were the most likely to be in a position where they were exposed to COVID-19. If we look at another community condition or social determinant, safe and stable housing, we can see how these racial inequities are driving inequitable outcomes throughout this pandemic. So about 1 in 6 Californians, or 6 million people, live in overcrowded housing or apartments that make it difficult to isolate from one another. About 2/3 of Californians who live in overcrowded homes are also essential workers or live with at least one essential worker. So we can see how these impacts are compounding and growing. We know that Black, Indigenous, and other people of color are more likely to live in intergenerational housing, oftentimes with older relatives who may be more at risk to complications from COVID-19, but who may not have the resources to isolate in a separate facility. Overcrowded housing was found to be a major risk factor for COVID-19 mortality, and in some places served as a better predictor of the number of deaths in a city than even the number of people who were 60 and up. Next slide, please. So the question is why, right? So why are Black, Latinx, Indigenous, and other communities of color more likely to work in low-wage essential jobs, more likely to live in housing that might not be safe or stable, or other areas of concentrated poverty, or are more likely to live near sources of pollution like freeways, heavy industry, or waste disposal sites? And the answer is that this is, of course, largely by design. And we'll dive into this deeper because in our next session together, we're going to focus on addressing racism as a public health crisis and strategies for advancing racial equity. But we know that due to historic and contemporary policies and practices, race and place are the largest drivers behind our inequities in our health outcomes. Our current moment demands action and accountability, and that is why you are all here today. In addition to the pandemic, due to the unjust murders of George Floyd, Breonna Taylor, Ahmaud Arbery, and other Black Americans, we have witnessed a nationwide reckoning on racial justice. And what we hope is a historic commitment to transforming our policies, practices, and systems. And we're seeing so many of your cities and your counties declaring racism a public crisis and acknowledging these deeply rooted structural barriers to good health and outcomes. So as Arundhati Roy so beautifully spoke, this pandemic, while devastating, can also be seen as a portal. It's an opportunity to identify those things that are not working. We don't want to go back to the normal that we had before that was not working for so many of our California communities and neighbors and families and friends. But instead, we're all coming together to envision a more resilient, equitable, and just future for all Southern Californians.